Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. iCON is the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health.
So now there are two persons who will give opening remarks. And first of all, let us have the director of the Department of Digital Emergency Medicine of UBC School of Medicine. And he is the founder of the iCON Health Network. He would like to help the multicultural communities. I think he is a person who is familiar to everybody. So let us have Dr. Kendall Ho. Oh, hello, Barbara. How are you? Oh, yeah. Oh, yes. Thank you, Barbara. So here I would like to thank everyone to take part. And then I'm happy to see you online. I'm representing the Department of Medicine of UBC, and also I represent iCON Health Network to welcome everybody. Today, not only we can see you online, and there are 4 different hubs, and there are many people who take part in the viewing hubs, and then I really welcome your participation. So today and tomorrow, we are talking about how to live with diabetes. And first of all, I would like to thank everyone so that you have your will and your desire to come and take in information regarding diabetes, how to prevent, and how to manage, and also to help families who are having diabetes. And I do hope that during these 2 days, we are able to help. And also, I'm very grateful for our specialists to coming in today and for tomorrow to spare their specialties and their strength so that everybody can learn. And the third, which is very important, it is our interaction. So just then, Barbara has mentioned about question and answer so that we can know each other, so that we know your need. And when you have questions, so we can try to answer, so that we can learn from each other. And I know, so this forum, there are a lot of cooperating partners, and then we really would like to express our gratitude. And today, I think everybody is clear about the topic. It is about taking charge of your health, living together well with diabetes. So actually, diabetes is affecting BC for 507,000 people, including diabetes, type 1 or type 2 diabetes. And every year there will be 33,000 people who's been diagnosed with this kind of disease. And on the whole, diabetes would shorten people's lifespan by 2 years. And according to the 2022 diabetes report, so it is estimated that in BC, so this number, it is so big that I really do not know how to read it. It is 56 million. So maybe it will be increasing to 73 billions. And then this is mainly spent on the serious complications of diabetes, including heart disease, stroke, kidney failure, blindness, and amputation. And therefore today and tomorrow, we are going to let you know more about diabetes and how to detect it earlier and what time you should go for treatment and ask for help and how to live with diabetes in your daily life. And there will be different areas about diabetes, about mental health, about exercises and how to self-management, and also what help can be available in the community. And therefore, we have two parts, which are today and tomorrow. And today, I'm very happy to introduce 4 different speakers. And first of all, the first one is family doctor, Dr. Charmaine Ma. Yes, and she was born in Hong Kong and grew up in Vancouver, and she worked as a pharmacist in various BC cities, and after completing her pharmacy degree at UBC. And after completing her medical degree at UBC, she moved back to Hong Kong with her husband, and now she comes back in Vancouver. And she is going to talk about what diabetes is. And the second one, we have a very knowledgeable registered nurse, Nora Ng, and she's going to talk about what is diabetes education. She is a very experienced certified diabetes educator who has been in the field for over 20 years. So she has wide knowledge and in this area and the services. And the third one is relating to food. And we have Gloria Tsang, a registered dietitian, who talks about the relationship between diabetes and food and how food is affecting us and what strategies that we can eat what we like. At the same time, it can help to control our blood sugar. And the last but then not least is Dr. Kendall Ho, who is talking about what digital tools can be used so that we can deal with chronic diseases even when we are at home. And I believe everybody knows Dr. Ho, and then I had just presented him. So, well, without further delay, so we would like to present Dr. Charmaine Ma. And so, Dr. Ma.
How are you? Thank you, Barbara. Yes, thank you, everyone, especially the iCON, for having the opportunity for me to share with all of you about diabetes and how it affects our health. But as a family practitioner, for sure, I see a lot of diabetes patients, and here there are many people who probably are familiar with diabetes, or maybe you have family members who have encountered the issues with diabetes. Barbara has told us that, in Canada, it affects a lot of people inside the province and outside the province. Every year, new people get diagnosed with diabetes. As well as a family physician, maybe out of every 10 patients, there's one who has diabetes. As actually, those who have pre-diabetes, the number is larger. So I can tell you some basic information about diabetes. I know that a lot of people have already are already familiar with some of the knowledge, some of the information. So be patient with me, because what follows, there will be a lot of senior specialists who will one by one explore more about diabetes with us. So today, I hope that I can, within the next quarter of an hour or so, to tell you what is blood sugar. We often hear blood sugar, but what about the different levels of blood sugar? Actually, blood sugar, what kind of impact does it have on our body? So there are actually many types of diabetes. You may probably have heard of pre-diabetes, diabetes type 1, type 2, and gestational diabetes. And some of them even affect children. Some of them affect pregnant women. Some of them affect just adults. So I will share this information with you. And I also will tell you about the risks as well as signs and symptoms. And I will also tell you about what types of different treatments for diabetes with medications or other methods. And at last, I will talk to you about if you realize that you have diabetes, if you don't do anything, if you don't treat it, what will happen in the long term. First of all, I want to talk about blood sugar and our body. I know that I like to use graphics to present my talk. So what kind of functions does blood sugar have on our body? So you can see that on the right side, there's a food factory. So actually every day, everything that we eat into our body, we disintegrate into glucose, and then it supplies to this little circle that's on the left side, which is the cell. And a lot of the bodily functions need the cells, so it needs sugar. So we have to have some sugar. But how do we bring the glucose into the cells? So what it does is what the pancreas creates, that's the insulin. Insulin, what helps us bring into our different cells those glucose. And in this graphic, you can see that it's very important, because in any part of this cycle, if something should happen, then you will suffer different types of diabetes. I've talked about different types of diabetes before. So they are pre-diabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. Now, first of all, I want to tell you what type 1 diabetes is. Type 1 diabetes, probably you are not so familiar, but some of you have heard of it, and some children even have that type of diabetes. So what it is it's a
Immune system.
Immunological malfunction. So those who suffer from type 1 diabetes would usually be diagnosed before the age of 30. And because of malfunction of the immunological system, our insulin that's produced by the body has been damaged and would stop producing insulin. And then you look back at the graphic, you don't have those little people anymore. So no matter how much how much sugar you take in, it doesn't go into the cells. So this is a fatal disease. So especially in the 18th century or before that, a lot of the children, because they had this, and they could not produce insulin, and they stopped functioning and they died. And fortunately, in 1921, here in Canada and Toronto, there were two Dr. Banting and Beth, those two doctors. They discovered the ways to extract insulin and then share this with the world. And they won Nobel Prizes for that because have this type of insulin that saved a lot of people's lives. So if you have type 1 diabetes, you have to inject insulin on a long-term basis, as well as take good care of your health and have a good balanced diet and exercise and test your blood sugar regularly. Maybe you are anxious because now today our main protagonist is type 2 diabetes, because 90% of the people have type 2 diabetes for those who have diabetes. So type 2 diabetes happen for those who are often after 40, but since around the world there are people who tend to be obese and we cannot control our diet, so blood sugar level tends to be higher. So they realize that it's getting more and more common. And this is not something that happened overnight, because our body gradually lose all the mechanisms, start malfunctioning, and what we produce in our body, the insulin is less, so the sensitivity has also decreased. Some people don't have very obvious functions. Like I said, it doesn't happen overnight. Maybe it happens over 5 years, 10 years, and then gradually you lose those functions. So as a family doctor, usually I would recommend after 40, then you should check your blood sugar regularly. And if we want to control type 2 diabetes, first of all, you have to have a balanced diet and a healthy lifestyle. Exercise, of course, you have to pay attention to that. And then you also have the periodic blood check, blood sugar check. And you may also need some medications. In terms of medications, we will have specialists to share different types of treatment methods with us. I'm sure you know that there are pills you can take, or even if it's serious, you need pills plus injections and other medications and insulin to control your diabetes. And you've heard that after someone sees that, family doctor, how was the blood test? It's okay. I just passed. So this may be someone who is having pre-diabetes. So you think you are okay, but it takes a long time to be diagnosed with type 2 diabetes, but if for pre-diabetes, it means that your body starts to malfunction, and everyone in 3 have pre-diabetes. So look around you. So here we have, I don't want to tell you how many, but many people don't know they have diabetes, pre-diabetes. And so because it gradually goes kaput. And if you have pre-diabetes, of course, you gradually develop into pre-diabetes, and so the risk for stroke and heart disease will be higher. So we want to maintain a good health, a balanced diet and exercise, because we realize that with a good lifestyle, whether it's diet or you can talk to a dietitian to find out more about diabetes. And so this will reverse the situation. So if the doctor tells you, well, you are into this stage, in the pre-diabetes stage, you should pay attention. So if you are alert and you're obedient and pay attention to that, it's possible to reverse it and not let it deteriorate into type 2 diabetes. So I believe that most of you, when you go have your blood test, you like to ask your doctor, so what kind of numbers do I have to remember? There are many numbers, actually. First of all, every country has different units that they use. Here in Canada, we use millimoles per liter. So how many millimoles is there in 1 liter? So in UK, USA, they may have different units. So just don't try to remember these numbers. Only in Canada, when you talk to doctors, they give you these numbers. Now on the right, lower right corner, you see that the 7-Eleven, this logo, everybody knows. So why do I choose 7-Eleven logo? Because other numbers are difficult to remember. So 7-Eleven is easy to remember. So what we use is fasting blood glucose. So after you So after about 6 to 8 hours after you eat, we look at the blood sugar level. If it's over 7, okay, like 7, 11, so that means you have diabetes. Another index we have to look at is after eating your blood glucose. So you poke your finger, or if after you have drunk some glucose, you can also have blood tests, sugar level test. So that shows you how your body can disintegrate blood sugars and how your body can use insulin as well as to absorb the blood sugar. If the use of that is insufficient, then our cells cannot absorb the sugar, and then the sugar level will tend to be high. And after a meal or after we've drunk glucose for more than 2 hours, if it's over 11, then it also represents diabetes. That's why 7, 11. So, okay, 7 on empty stomach and 11 on a full stomach. So, but just don't be too panicked if you poke your finger and you find out it's 11, because after you have tested once, the doctor may have other recommendations. If you have pre-diabetes, the doctor can tell you how you can treat it. And some people want to know that the indices actually you test it every 3 months. So this is something called A1C. That means that there's protein in our blood that is associated with sugar. So every 3 months, we have to test our hemoglobin. So if in the 3 months, the hemoglobin index A1C, you can tell that in the past 3 months, your blood sugar level. So somebody may say that, oh, on an empty stomach after I have fasted for more than 10 hours, that means that I can lower blood sugar level, but actually cheating yourself, because when you look at the 3-month blood sugar level, we can see within those 3 months, there may have been times that you have gone over the standard. So the standard is 6 to 6.4. If it's over 6.5, that means you have diabetes. Again, 7-11 means fasting blood sugar 7, full stomach 11. If you have any questions, you should talk to your family doctor. So finally, I want to tell you about gestational diabetes. So gestational diabetes is when a woman is pregnant, the risks are high. Every pregnant woman in BC with between the 24 to 28 week pregnancy, that's in the midterm of the gestation, the doctor will prescribe a blood work test, and so to find out that if it's the functions of producing insulin have deteriorated. First of all, the premise is based on that a woman does not have diabetes. That means before a woman's pregnant, she never had diabetes. But if a pregnant woman during her pregnancy, if she does not control her blood sugar, then it may cause the baby and may create risk for the baby. So these risks will also increase. So I suggest that pregnant women should listen to their doctor during the midterm of their pregnancy. They should also have a blood test. And then after they gave birth, and the symptoms will decrease. So it means that during the pregnancy, the blood sugar level will increase, but after they have given birth, you can see that maybe in future, the risk of having type 2 diabetes will also increase, meaning that she herself, her insulin, pancreatic function has deteriorated. So if someone who has diabetes 2, type 2 diabetes before, you should tell them that after they have given birth, they must talk to the doctor as soon as possible. The next thing that I want to talk about is a treatment for diabetes. So I like I said, I like to use graphics. So what I want to tell you is that actually type 2 diabetes, what kinds of treatments there are. So like I said before, you should improve your diet, a balanced diet. So if you keep increasing your blood sugar when you eat, when your mouth doesn't stop eating, so that's bad. So we have to choose foods that have good level of sugar contents. The other thing is uh, be persistent in doing exercise and keep your weight in control. I've said that already, that there is a problem with obesity on the global scale. So because people tend to do exercise less, they spend more time on the computer, in front of the computer. So we should also pay attention to that. And there are medications to control blood sugar. Later on, we will have doctors who will talk to us one by one what kind of medications, whether they are taken not orally or injected. All these will affect our glucose, our pancreas, and as well as our insulin, even our muscles. They may be sensitive to the sugar level in the insulin. Finally, you should also try to self-manage through different methods. In other words, you should increase your knowledge. So I thank you all for attending this self-management, the desire and the hope to self-manage, and that's why you're attending this seminar. So because you want to know about, want to know more about this, and then you can treat yourself and prevent that better. Finally, I wanted to tell you something about, if you know that you have diabetes, but you say, that's all right, it's just a bit over excess of blood sugar. What harm does it do on me? Well, I can tell you, for example, it's just like a faucet, a tap in our water, in our home. If you use it long, then there must be some rust, some stains in our blood levels. So there are 3 highs in Chinese: blood pressure, blood sugar, and lipids. All this, if you do not control it on a long-term basis, it will affect your blood vessels, especially if you have diabetes. For decades, on a long-term basis, it's like water pipes. They have ruts. They have rusty water. So if it keeps on a long-term basis, then it will be damaged. So if that happens to our body, because our body, we have a lot of capillary vessels which supplies blood. So in our brain, if something happens, if it's clogged, then we may have a stroke. If that goes to our eyes, maybe if our retina has problems, then we will have vision problems. So for those who have type 2 diabetes, we will every year ask them to check their eyes. As far as cardiovascular problems, so this may happen if it's clogged, because our kidney has a lot of capillary vessels, and if we do not control our diabetes well, we will have kidney disease. Finally, it's our nervous system. You may have heard, maybe, someone has diabetes. It's been a long time. He's lost or she's lost his leg. That's because the nervous system has problems, and in the end, they will lose their sensitivity, and then they will have to be amputated. So hopefully, after this talk, after I have shared this very basic knowledge of diabetes, about pre-diabetes, type 1 diabetes, type 2 diabetes, and I have also talked to you about treatments, and don't just ignore it. Thank you very much. Okay, thank you, Dr. Ma, for your very detailed talk. Diabetes it can really affect us in lots of ways, from head to toes. There are many symptoms, many organs can be affected in different ways. So everyone should pay attention to how to manage it, manage diabetes. What follows is we have a short video clip to show you. This is one of the resources in the community. This is a a Health Link BC that's set up by the BC government. And through this link on the computer, you can get information because there's a 24/7 healthcare services. So you can call 811. I'm sure that most of the people have heard of 811 of their services. So what's next? We have video clips in 3 different languages: Cantonese, Mandarin, and English, and we will play that for you. So enjoy it. HealthLink BC video clip and what it is and what services it offers.
Technology's changed our lives. Think about how we bank and book holidays. We still rely on professionals, but we're doing more ourselves, using phones, computers, and apps. It's not extra work, it's extra control. We like that. And that's where healthcare is headed. Now, we've always fixed simple health problems ourselves, asking friends and neighbors first. But who hasn't wanted more reassurance? That usually meant a trip to the doctor or hospital. Today, that's changed. We have instant access to incredible health information, however we want it, not to mention unbelievable tools and services. Just check out HealthLink BC. HealthLink is a 24/7 service that helps patients manage their own health. But what it really does is empower us. Let's start with HealthLink's phone service. When you dial 811, you're connected to a health system navigator who guides you to the expert you need fast. A nurse, a pharmacist, a dietitian. Experts who are trained to deal with problems over the phone and with access to 130 languages, no less. Imagine how useful that would be if it's the middle of the night and your baby is running a fever. Instead of going to emergency, you can get a health professional to walk you through proper treatment right away, right at home. Online at healthlinkbc.ca, there's medically approved information on thousands of health topics, tests, and procedures. You can check symptoms, find local resources, learn how to maintain a healthier lifestyle, even email dietitians for advice. That's exactly what the anxious mother of a child with food allergies did. She went online, got connected with a dietitian, and together they created a meal plan for her child. Now there's a mobile app that has lots of the same information. With its mapping function, you can even locate the hospitals, clinics, and pharmacies closest to you. Of course, there's always the BC Health Guide Handbook. You can find it at your local pharmacy. The handbook walks you through 190 common health concerns. It's super handy. In fact, there are even stories of people from BC using it in the US to avoid going to the hospital because they didn't have insurance. So you see, these are great services. 811 helps about 1,200 people a day across BC, and healthlinkbc.ca gets over 10,000 visits every day. These services take patient empowerment to a new level, supporting the biggest untapped resource in healthcare, us. That's a connection worth thinking about.
So if you go to a doctor, the doctor tells you, well, you have diabetes, what do you have to watch out for, or you have to start taking medications. So a lot of times family doctors will refer you to someone in the community, some centers who have educational courses for diabetes. So what are the contents of these educational courses? Why should you go there? So these courses, these programs, as far as I know, should be free, but you have to be referred to by a doctor, and then you go to attend your classes to find out what is diabetes and what you should watch out for. So we're honored to have today an educator for diabetes, who is a registered nurse, Laura Ng, who will tell us about the contents of the diabetes education program. So if someone who is diagnosed with diabetes, they should they want to know what they want to learn and what are the resources in the community to help us. So I will pass the mic to Laura.
So hello, everyone. Thank you, Barbara. So I am Miss Ng and the nurse. So there are quite a few learning objectives. So let us take a look. So first of all, we would like to understand who the healthcare team members are and how they can help, and to learn self-management skills, and we have to learn them. And also we would like to know more about community sources and how they can be of help. So the next one would be about testing of blood sugar. So why do we have to test our own blood sugars? So just then the doctor has says that if our blood sugar is not controlled properly, there will be the risk of having complications. And how are we going to do test? So actually there are 3 different ways of testing blood sugars. The first one is doing hemoglobin A1C, which is done in the lab, and the doctor will write a prescription, which is done every 3 months. But this is an average number to let us know what is the result of your self-management of diabetes every day. And for day-to-day activities, it has to be done in the home. And therefore, the second one is we say poking the finger, which is by sugar testing. And the third one is a new device, which is called a glucose sensor, which is very popular in the past few years. I will spend a bit more time talking about this one. So if you would like to test your blood sugar, and you have to know why and then the target. So before meal, most people's target who are having diabetes and with an empty stomach or fasting, the result should be targeted to be between 4 to 7. And 2 hours after a meal, it should be within 5 to 10. And when we say after meal, we start with the first swallow of your meal. So in what circumstances do we have to test our blood sugar? So usually when you're newly diagnosed, or when your A1C is high, or when the doctor is prescribing new medication to lower your blood sugars, but there may be a risk of hypo blood sugar. And well, there also may be other medications that can cause higher blood sugars, like some other medications. And for some professional long-distance drivers, they have to test their blood sugars every 4 hours. And also, if you're on insulin and you're being hospitalized, and your blood sugar will also be tested. And blood sugar monitoring, well, if you are poking your finger, so every time if you do it, it will tell you the blood sugar at the minute. And in order to know the trend of your blood sugar, sometimes we would like to test not only day to day on the same hour. So for some who do your blood testing every morning before breakfast. So this is not done that way. We would like you to test your blood sugars at various times of the day so that we know the trend of your blood sugars. And now there are a lot of different devices which provides cell phone apps. So they can be connected for your Bluetooth, which can be connected to the clinic of your doctor. So therefore, also here are examples of how to monitor and test your blood sugars. So for example, so one day you test before and after meal, before breakfast, and the second before lunch and before and after lunch, and the third day before and after supper, or you can even vary that. So the best way is to talk about it with your doctor. So for the glucose sensor, I would like to talk about it. Now, the technology is just like, it is a very, very narrow needle, and it is placed under your skin, and you can feel the fluid between cells and to test the sugar in that. So if you poke your finger, it goes to your blood vessel. But for this device, usually it's placed in your arm or on your belly. So because it can report to you your blood sugar every minute, and therefore this sensor can analyze different reports. And if you think that, well, I do not quite understand all these different reports, then you can talk about this with the diabetes nurse or the doctor to understand more. And another thing I hope everybody can pay attention to is the proper injection skills, because now not only diabetes, but there is another thing which is called the GLP-1A injectables, which are commonly prescribed by the doctors. So they are usually in the form of injectables. And I would like to touch on the skills of injection. Now, just then you can see from the screen, the best thing is to use a needle of 4 mm and 32 gauge, because this is already good enough, because the thickness of our skin is on average 2 mm. And if you use 4 mm, the injectable medication would not go into your muscle. And you can see that there are two caps. One is small, one is bigger one. You have to remove both caps before you can give injection. And nowadays there are new needles, and there is a center which you can see on the right, there is something to push so that it would not go into your muscle. And the old one is the left one. So if you're using injectables, pay attention to what needles that you are using. So for proper injection skills, of course, you have to wash your hands. And so nowadays, to put together the injectables, usually you do not have to do these steps. And then usually we are using disposable injectables. However, for insulin, some insulin, they are mixed up, and then you have to shake them up for 10 times. And every time if you need a needle, and make sure that you use a new needle every day, because if you use it more than one time, then it will be easy to hurt your skin tissues. And also, in order to see whether it is working, you have to dial it to 2, and then to push it to make sure that liquid is going out from the tip, and making sure the needle is working before you give yourself the injection. There are different parts of the body that we can do injections. So 2 fingers away from the belly button, that part we can give injections. Otherwise, the whole belly we can do that, and also the side of the thigh. And for the for our bump, you can do them on the side. And it is important to rotate between different injection areas. And I would again to explain further later on. But, I have a system to remember. Maybe in the morning on this side, in the afternoon, the other side, and in the evening, that side. So you have a system that will be best. So if you do it, make sure that you have facing at 90 degrees and slowly squeeze in the water, the medication. So make sure you see the 0, and then before you pull it out. And after you are done, you can put it in a little box, and you can buy that from the pharmacist. Now, the diagram on the right reminds you that you do not have to press hard. And if you would like to make injections more comfortable, so use the finest needles. I have just talked about it. And also try to relax, reduce your anxiety, because the more anxious, the more painful. If you are worried that you are not very good at it, then try to do it on another object. So if you do it properly, actually it's pain-free. So if I said, if you repeat it, then the needle will be blunt, and the medication works best in room temperature. But if you have been putting it in the fridge, take it out 15 minutes before injection. So actually, you don't have to put it into the fridge if it's been opened. And if you keep injecting to the same location and same site, you can see from the diagram that that area can be bumpy or hard. So when you inject, well, it may not hurt, but it is not good for the body to take in the medication. It's not as effective. So try to avoid the hair roots, the scars, and then if the injection is a really large one, then you talk to your doctor. Maybe you can consider splitting it into 2 doses into different areas. And here we have some community resources, and there is resources in Chinese as well. So I'll quickly go through that, because I'm going to touch on another important skill, and which is to learn how to take care of your food, which is very important, because if our blood sugar is not controlled properly, it will affect the blood vessels as well as the nerve in our feet, and that may cause a feet problem. And if you have feet problem, then it will affect the quality of life. And also, it will increase the risk of death. And the most important thing is prevention. Prevent having foot problems. So I have got some tips how to prevent that. The first tip is to every year, so you can ask diabetes nurse or the doctor to do regular and thorough foot examination. So in this way, you can detect problems and tackle with it as soon as possible. And the second thing, if you cannot touch your toenail or your vision is not as good, then have a foot care nurse to take care of your nails. And the third tip is, in certain situations, people have to who are exposed to higher risk. For example, people cannot feel heat or cold or sensation, cannot feel pain. And for more elderly people, their skin tend to be thinner. And for diabetes patients, the skin tend to be drier. Another thing is, if you are not having very good nutrition, or you are certain medications like steroids and anticoagulants, and then the risks of having problem will be increased. And also, if you have poor balance or mobility, and you may be bumping into objects and then causing injury to your skin. And this is something to avoid. And the next tips is to try to get proper shoe wear. Now, it is important to get the proper size so that it can be properly fitted. So a pair of good shoes, how does it look like? So there is enough support. And when you're walking, you can feel secure, and the heel should not be more than 1 inch. And the sole is better to be a bit thicker. And there are some design down at the bottom to for anti-slippery. And also between the big toe and the heel, there will be room for one finger. So when you're wearing shoes, making sure that there is nothing foreign like sand or other things inside the shoe to avoid friction. And also wearing socks. The socks, I hope that it is in light color. Why is it so? And also is it is air breathing so that it is not creased. The reason is you can, if you have any signs like redness or swollen, then go to the doctor. And things to remember will be, this is the 6 tips. So first of all, you have to check your feet to see whether you have swollenness, whether you have injury. And after your shower, make sure you dry it up. And every day put on moisturizers on the top, on the bottom, but don't put it between the toes. And when you're cutting the toenails, don't make it too short. It has to be flat, not curved, and also violet. And if you have a collarless, don't use knives. So if you are soaking in your bath, make sure you test the temperature of the water before you put in your feet. Don't smoke, because smoking would harm your blood vessels. And then we have talked about shoes, and don't walk barefooted. So you have to walk even indoors wearing your slippers. And then for your nails, if they become thickened or ingrown, then you go to your doctor. And for the skin, if it's calluses, a blister or crack, see a doctor. And whether it's redness, infection, go to your doctor. And if you had amputation or you had infection in your feet, then you have to pay attention to the following. So for these people, they have to go to the doctor if you have foot ulcer or amputation. Now down there, woundscanada.ca, there is a lot of information and there is a lot of video, and they are provided in English. And also they have a Facebook group for people to join in, and there is English information. However, this website also includes some Chinese information. I have put a little bit on the screen, and you can print it out and to study. And also on diabetes.ca's website, there will be information, and you can see some Chinese information and resources on the screen now. There is other resources in the community I would like to mention. So for the diabetes care team, you can see different expertise. So those on the left, these are people you would see regularly. And then people on the right, you may not be seeing them regularly, but only when needed. So for the community source of foot care, I would really like to bring your attention to one thing, which is for foot care nurses, which is the 4th one. So there will be nurses who can come into the home, who can cut your nails, who can examine your feet. And then you go onto the website, you can type in your address, and you can know which nurses work in your area. This is another one for foot doctor. You can go onto this website. And another one is for smoking cessation program. You can go online to find out more information. So all the resources above, you can reach them through all these different emails. And for Fraser Health Authority, they have Chinese information. And for Vancouver Coastal Health, they have a lot of information. And for the Dexcom.com. It is about glucose sensor. And the last one is also about the glucose sensor. And for Diabetes Canada, there is a lot of updated information regarding diabetes. So this is all my sharing today. Thank you, everybody. Oh, thank you, Nora. So you have so much information. So this is just a little bit of the information taught in the class. Oh, so this is so important because of the blood sugars, and it can vary every day and from hour to hour, and how to test is a very important message. And also just the feed, there is so much information to take in order to protect the feet so that the feet cannot be injured because of high blood sugar. And then if the blood vessels, which are furthest from the heart, and they are affected, and especially when you're older, you tend to be colder in the feet, then it will be easy to have injury, and then which is go unnoticed. So through the education center, our awareness is being raised, and I hope the risk of amputation can be reduced, because with improper care, then amputation may really happen. So I think the most important thing is to examine and to put on moisturizers to prevent cracks and dryness. So thank you, Laura. Thank you very much. So if you have question for Laura, please put in your question into the box, Q&A, and later on, during the Q&A section, we will try to answer as many questions as we can. And down there, now we are going to have the second poll question. And so everybody, please take part. So this question is, I better understand who the healthcare team members are and how they can help with diabetes management. Now, we have talked about so much. So we know that diabetes relates to what we eat. And healthy eating strategies for diabetes. We are very happy to have our next presenter, Gloria Tsang, who is the registered dietitian, to give us tips on healthy eating. Especially now we mentioned about food is being very expensive. So it's getting more and more expensive. So what tips do you have so that we can help everyone? And well, I'll pass it on to you, Gloria.
How are you? How's everyone? I am Gloria Tsang, a registered dietitian. You can call me Yan Yan or Gloria. Let's try to move the slides myself. Okay. Today, the main thing is we want to understand how food may affect your blood sugar. So we always say blood sugar. So you may think that you eat something, your blood sugar level increases, but it's all food that do that. So we want to learn more how to plan our food in each meal, how we can plan our meals every day to manage your blood sugar. The most important thing is learn how to read food labels. So if you read a package, on the back of it, you see a lot of information. Of course, there are nutrition facts, say there are calories, how much starch and all that. So what are we looking for then? So first of all, I want to ask you a lot of times a question that's been asked of me a lot. Does eating too much sugar cause diabetes? So there should be a poll, but anyway, you can answer for yourself. So does it mean that because you're eating too much sugar that causes diabetes? Is that true or false? Well, actually, it's false. sugar itself does not cause diabetes. We have diabetes not because we have too much sugar or syrup. That's not the reason. But if you eat too much sugar or too many calories in your food, that can lead to obesity. Obesity is a risk factor for diabetes. Well, we have to know that everyone is unique, and everyone, whether he or she has diabetes or not, everyone's different. And for that reason, there's no one meal plan that suits everybody. Why should I mention that? Because a lot of times my patients tell me, oh, they see something online, some diabetes recipe, so they a menu. Is that suitable for you, your sex, your age, your lifetime habits, your hobbies? So there's no one meal plan that suits everyone. There are some facts and myths I want to distinguish. So many people know that carbohydrates, so Asians and Chinese, we say that these are starch foods. So actually, all carbohydrates can affect your blood sugar. That's number one. But diabetes patients, does that mean that they cannot take carbohydrates? The answer is no. People with diabetes can also eat carb foods. Why should I say that? The main reason is that carbohydrates, actually, there are three types of it. First, there's starch. The second one is sugar. And the third one is fiber. So all three of them, a lot of times we look at the food labels. So the labels will list all three different constituents of carbohydrates. So we call them total carbohydrate. Actually, carbohydrates, we talk about pasta, noodles, bread, but actually there are other foods that contain carbohydrates. For example, sweet potatoes, yams, potatoes, fruits also, milk also, and juice also have carbohydrates. So what we want to learn now is distinguish which food groups can cause different reactions of blood sugar. On the left side, we see light orange, that's liquid sugar. That means fruit juice and drinks, for example, soda, pop, or packaged Slurpee or things that we buy outside, bubble tea. So the beverages that we buy outside, if it has liquid sugar added, you can see that the reaction can come in very short term. It means blood sugar level rises. So we also see that it then goes down. The next one is fruits. So once you have taken fruits, it also creates reaction on blood sugar level, but it's lower. The next one is starch, for example, rice or vermicelli or noodles or udon. So all these starch foods can raise sugar level, but it takes longer, and the speed that raises the blood sugar is actually less. And then we see that the milk also has carbohydrates. Yes, we say that it's lactic sugar. So lactic sugar is actually a kind of sugar. So it's not added sugar, it's a natural sugar, and it also raises blood sugar level. So the next one is protein. So for example, meats, tofu, bean curd, these protein foods can raise blood sugar level a little less, and it takes longer. And we also see that the first four groups have starch or have carbohydrates, but different foods can cause different ranges and different times for blood sugar level to rise. And then I have picked out instant oatmeal to show you. So these are packages of instant oatmeal we can buy in sugar markets. And many times we can see that nutrition facts from there. So I have two different types of instant oatmeal. One is original, the other is maple and brown sugar added. So now we look at a package of instant oatmeal original. Maybe you have taken courses for diabetes. You've seen that what you have to look for is how much or how one serving has. That's 28 grams, and the other side is 43 grams. The one has 43 grams has that many calories, 160 calories. The other has 100 calories. So how do I know which one is better? So I know that all of you who are attending, you are smart and you know diabetes well. So what we need to know is, what we need to look at is carbohydrates. So here you can see with a label. So in this area, look at, this is the area you should look for, carbohydrates, and then you can see down below that you have fibers. And there are soluble fibers and insoluble fibers. Those are also in the labels that show how much sugar is there. So what we are talking about is not added sugar. We're talking about total sugar. So if you don't buy milk, how come there's still a sugar? It's the same reason, because it's got added sugar as well as natural sugar. So even if you see sugar, don't be afraid, because it really is not that harmful. So on the left side, you see instant oatmeal that's original flavor, and then you can see sugar is 0 grams, no sugar added. On the right side, you have sugar added, that is maple and brown sugar added. You have 13 grams of those added. You can see easily the distinction between the two. So after you have added 13 grams of sugars, then the carbohydrates have increased from 19 to 33, just like that. So that's because added sugar has been added. So that means this package is heavier. So we can see very clearly between the left and the right. Actually, the right side, everything that's been increased is sugar. And because there's more sugar, it's heavier and more calories, and the total carbohydrates is also higher. Actually, there's just more more added sugar, nothing else. So we have to look at two facts. That is the total carbohydrates as well as added sugar. How much has been added? We have talked about this is 13 grams in one. So that means that's 3 tablespoonfuls. That's quite a bit if you go to a coffee shop and add 3. But 3 tablespoonfuls of sugar, that's a lot. So for breakfast, you have to eat something that's so sweet. Well, let's do our math. A lot of times, I know that a lot of you here, some diabetes patients have seen a dietitian, and dietitians usually don't tell you how many servings of carbohydrates you have to eat every day. So you have to do your math. First, we look at how much carbohydrates, total carbohydrates is there. It's 19 grams. And then you have fibers, that's 2 grams. So that's indigestible. In other words, that usable carbohydrate is only 17 grams. So that's 1 serving of carbohydrate. Food in 1 serving that has carbohydrates. So if you want to calculate how many servings, if you want to know how many servings you need, look at that, carbohydrates minus your fiber. So that's your available carbohydrates. So that is 17 in that case. Also, take another example, the one that has maple and brown sugar added. The total carbohydrates, how much is it? It's 33 grams. Then the fiber there's 2 grams. So available carbohydrate on the right side, you can see on the middle, you can see 33 minus 2, that's 31 grams. Meaning that if you want to eat something that has added sugar, this bowl of instant oatmeal has already 2 carb servings already. So without blood added sugar, there's 1 serving. So that leaves room for some other food. But if you choose to eat this kind of 2 carb serving in that, so you don't have other space or quota for other foods. So it's very important to have the right choice of foods. So we can now look at whole foods. Whole foods, it's not packaged foods, it's not processed foods, it's whole foods. Does that mean that you cannot take carbohydrates? No, actually, a lot of healthy carbohydrates are in our foods. For example, beans, whole grains, even breads, spaghetti, pasta, vermicelli. They also have different kinds of carbohydrates and fruits and vegetables, of course, and then sweet potatoes. So these whole foods actually in and of themselves have more fiber as well as more protein. Remember, so if you look at your file, you will see that more fiber and more protein. What are the advantages? So now we'll come to glycemic index. So many times you've heard of this. So what is glycemic index? So it is after you have had 1 serving of food, and whether it's faster or slower for the blood sugar level to rise. For example, we take liquid sugar, it rises quickly, and it rises high. So this kind of food is high glycemic index food. The low glycemic index foods are those that will take more time to digest, and it takes more time to digest, and because these foods may not soar, I shouldn't say soar, I should say slowly rise, and then as well as the range is smaller. So we call that low glycemic index foods. How does it affect the blood sugar level rise? Now, I've said that if the food itself has fiber as well as protein and maybe a little bit of fat, so what kinds of foods have all these 3? Think about it. What kinds of foods have carbohydrates, fibers, as well as protein and fats? So, well, off the top of my head, I can think of nuts, walnuts, hazelnuts. Actually, those foods, if they have all these nutrients, so good nutrients, it will cause a lower rise in blood sugar level. And then we'll talk about acidity. We say we have some pasta salad and put it in the fridge, and then we put in some a salad dressing, or actually the acidity will actually increase the time to digest it, and then it also lowers the range of the glycemic index, and also how much is it cooked. For example, you don't, if it's too raw, or if it is, they tell you to cook it for 4 minutes, so you cook it for 10 minutes and it's overcooked, and so there's a difference between the 4 and overcooked and undercooked. So actually, all of the starch and protein has been disintegrated, and it actually makes it faster to rise, for the sugar level to rise. So another thing is the food sliced or chopped. For example, oatmeal, we talked about just now. There's instant oatmeal. It's been steel cut, and some has been cooked. So So that's why you can zap it in the microwave for 1 minute and you can eat it. So there's nothing called steel cut. Actually, it's not compressed, it's not cooked. So maybe you have to cook it for longer. So you have to, it takes more time to digest it. And so the blood sugar level rise will be lower. So that's why we go back to this graph from before. On the left side, you have liquid sugar. And then those who have fat or protein are on the right side. So you can see that the glycemic index and the ones on the left with higher GI, they have a higher GI. And on the right side, you have foods that have protein and fiber. They have lower GI. I don't know why I am missing the upper portion. The colors are not there. It doesn't matter. I can tell you what they are. On the first line, actually is calories, and then the two green ones are total carbohydrates and fibers, and then you have available carbohydrates, and down below you have protein contents. The first column that is on the leftmost side is white rice, just plain rice. The middle one is brown rice, and then the third one is black rice. So why should I choose rice? Because a lot of times my friends or my patients, they ask me, does that mean I cannot eat rice? I would tell them, well, let's see what kind of rice you take. It doesn't mean that you cannot take all kinds of rice. So let's do the math again. For example, the plain rice in one bowl or 1 cup, not one bowl, calories wise is 242. So if you look at the calories, it's about the same, 242, 218. It's about 10% difference between all of them. But if you look at the total carbohydrates, about just plain rice, it's 53 carbohydrates, but fiber is only 0.6. So available carbohydrates is 52.4 grams. So if you talk about one serving of carbohydrates, if it was 15, so there's 3 servings already. But if you talk about brown rice, the fiber content, because it's lower, that means total carbohydrates are also lower. So it means there's 10 grams less of available carbohydrates. That means you only have to change the type of rice, and then you already can reduce the intake of carbohydrates. And then I like black rice myself. A lot of times they'll call it purple rice or black rice, and Chinese supermarkets or Korean supermarkets, it's black. So that's black rice. You can see that the total carbohydrates like brown rice is lower because it's a whole wheat food, and so it's a different kind of rice. You can see that total carbohydrates is about the same as brown rice, but the protein contents are higher. So that means the blood sugar level range will be lower and the speed will take longer. We've talked about that there's a difference between whole grains and other grains. For example, wheat. So there are all 3 types of sections. So plain rice takes up the middle one because there are other nutrients that have been taken away. But if you talk about whole grains, like whole grain breads, or there's also the whole wheat and black rice, they don't grind away the shells. So different parts of the grain where can offer you different nutrients. I was talking about shells, right? You heard the word shells. So if there are more fibers in the shells, then it can lower the GI. So in this whole grain, there's more fat. So that's why whole grain foods will make your blood sugar level rise lower. So you can change from rice to brown rice, and you can kill two birds with one stone. So whole grain foods, whole grains have at least 3 to 5 times of those contents. So you've heard about the difference between plain rice and black rice because of the carbohydrates, the difference. So it's more suitable for diabetes patients because the available carbohydrates are lower. So there are more fibers. So it means that the feeling of a full stomach, it's longer. So there are examples of whole grains, for example, brown, red, black rice, whole wheat bread. You can buy in the supermarket the whole wheat pasta, or millet, quinoa, or corn. Actually, these are grains. So we just talk about oatmeal, instant oatmeal. So actually, it's one of the whole grains foods. So, but it's just been ground and sliced. So we also like to eat Japanese noodles, for example, soba. Actually, it has buckwheat there already. Actually, the most important thing is, you know why I'm talking about this, why I bring it out this list? Because you can notice that available carbohydrates gets lower and lower as the chart goes down. So you don't have to eat less. It just means that if you change more into whole grains foods, and the absorption of carbohydrates will be less. So very simply put, you say, I don't like to eat black rice, purple rice because they are too hard. Actually, the patients themselves, they may complain, I don't like hard foods. So how about mix them together and don't go from one extreme to the other. So you can have 1 cup of white rice, but 2 tablespoons of black rice. Take it slow. And you know why I like the black rice? Because once you cook it, it looks beautiful. It becomes purple rice. So, and you can add just 1 1/4 cup of water to deal with the excess black rice, and then you mix it together. It becomes purple rice. It's very simple, doesn't require a lot of work, and then you can have a beautiful looking plate. So you can eat brown rice or black rice if you want a quick fix in a rice cooker. If you don't want to spend 1 hour, so you can soak the black rice or the brown rice before you put it in the rice cooker and cook it together with the plain rice. So we talked about the balanced food plate. So look at this visibly. If you put it on a plate, half of the portion should be vegetables or fruits, and 1/4 should be proteins like meats and beans, legumes, or bean curds or yogurt. And there are also proteins, and 1/4 should be your starch foods, high carbohydrates foods. So if you choose whole grains foods, then we can reduce the intake of carbohydrates. So what I wanted to share today is here some community resources. You've seen that round plate. Actually, in BC and Canada, there are many resources. Barbara and different speakers have talked about 811. So a registered nutritionist can talk to you about that. And there's the Canada Food Guide, which is also available in Chinese, and you can look into that. And then also there are resources in Chinese from the Diabetes Association. Thank you very much. Thank you, Gloria. Very detailed, very quick presentation, because when we eat in Chinese, for Chinese, food is everything else, above everything else. So So it's very important to know about this food as a science, eating as a science, and this is very endless talk, you can say. So if you have questions you want to ask Gloria about food, you can put those questions into the Q&A box, and later on we will try to answer them. Thank you, and you can have a rest for the time being, Gloria. Okay, so it's time, after we've heard how to take care of yourself and about food that you take. Actually, now, since the pandemic, many people want to go online to search for information. There's one thing that that we search for digital tools. So what kind of tools are available that can help us? So before we go to Dr. Ho's segment, we want to take another look at the 811 video clip.
What is e-health? Have you ever wanted help managing your health or your family's health? Like getting your lab results faster or finding more information about an illness or medication? Or perhaps you wanted to start exercising but weren't sure where to begin or how to set and achieve fitness goals. We've all had questions about our health, and sometimes we need help answering those questions. Technology can help us get what we need. You are probably already using technology to find information online or to communicate with your friends and family. Maybe you use it to do your banking or to plan a trip. The same tools can help you better manage your health. This is called e-health. There are different ways technology can support you and your family's health. For example, you can get health information and education from traditional sources like TV or radio. Or you can use the internet to look up information about a health topic or to learn more about a disease. You can also look up your lab results online, track your fitness activities with an app, connect with healthcare providers online, join patient support groups using social media, or access your health records. All of this is e-health. E-health is helping patients and healthcare providers work together to ensure faster, safer, better care. And many of these e-health tools are available in BC for you and your family. For resources and ideas on how to use e-health safely and in partnership with your healthcare provider, visit our website.
Digital medicine, now we have to pass this to Dr. Kendall Hall to tell us what tools are available these days to help you manage diabetes or other chronic diseases. Kendall, I'll pass the mic to you.
Yes, thank you, Barbara. Oh, thank you, everyone, those specialists before me. So it's been really attractive, and I'm really glad to hear that and know that most people find all the information helpful. And for this section, we are going to talk about digital tools for diabetes self-management. So there are 3 different objectives. The first one is to know that there are many ways to see doctors or manage your own health using computers, cell phones, or apps. And the second, give common examples of how this can be done for diabetes management. And the third, how to use virtual care and what to pay attention to. So the very first thing is, well, when you talk about digital, oh no, I'm not very interested in it. It is very difficult. But I can tell you, actually, so gaining access to digital health or virtual health is actually pretty easy. And then even when you start to do it, it is easy. And then there are a lot of things that you can further explore. So today I would like to introduce you to the entrance of this technology. Now, actually, we are using the technology we are using every day. So many of you are watching our forum with a with a computer, and even for the viewing hub, people have knowledge about computers. And also we have smartphones as well as tablets. So these are actually having a lot of more and more information, allowing us to self-manage our health. So now I'm not too sure. Oh, okay. Now I can move my slides. Okay. Yeah. So now I may ask my colleagues to control the slides then. So let us look at the digital health. So many a times we are using our cell phones, our smartphones. So on the right-hand side, there are smart watches, which can keep track of our heartbeats. And on the left, not only taking record of our blood sugar, but also our blood pressure, as well as our heart rate. And in the center, there will be a lot of apps. There will be apps telling us how to do exercises, not only telling you what to do, but there is a person who is demonstrating. And these are very, very helpful to us. So as we have said, exercise is a big component of prevention or managing diabetes. And tomorrow we'll get more information regarding exercises. So the next slide. Now, earlier on, Laura, the registered nurse, has mentioned this. I'm not going to talk about too much of this. And how can you control your blood sugar almost continually? So this is what we have on the left. This is one kind of the products, and which is called the Abbott Freestyle Lip. And it is a little sensor which is placed on the shoulder and which is connected to your smartphone. And you can see the trend of your blood sugar. And then after eating an orange, you can see your blood sugar is rising a little bit. So this does not only allow us to control our blood sugar, but also have immediate feedback on our body's response to the food we have just said. For example, having the instant oatmeal, you can see how our body responds. And then on the right-hand side, the top right-hand corner is the insulin pump. So it can detect what is happening inside our body. Just at the very beginning, Dr. Charmaine talked about the little man who was moving the sugar into the cells. And these, according to your blood sugar level, to help you to have insulin input. So when you look at these devices, so before we have to poke our finger, see what our blood sugar level, and then we inject our own insulin. But now there are devices which can help us, and they would automatically do that. And on the right lower corner, this is the whole system. It is not only detecting our blood sugar level and how much insulin we need. And there will be also artificial intelligence, which can help us to calculate how much insulin that we need. So to help us further control our diabetes. We're just having a very brief introduction. So actually, Laura has talked about it. Of course, if you're interested, then you can talk to your doctor. And also, you should be more engaged in education programs and to talk with the diabetes nurses to have further understanding. And today, I'm just telling you devices that can help us and how using these are being helpful. So the next slide. Now, the next one is a more general use, which is a virtual care. So just like in the diagram, before we had to see the doctor face to face, and many people need that. But now there are ways we can meet our doctor through the computer, smartphone, or the telephone, or even a tablet. Now, for this one, it is not really for the doctor can reach out from your smartphone to test your heart, to test your pulse. However, there are many things we can do. How can we use such information and communication technology to provide virtual care? So what does it mean by virtual and long distance? If I am in Vancouver, and my patient is in Vancouver Island or BC northern BC. However, sometimes the patient may find it inconvenient or impossible to go out of his home. For example, if the person is having back pain and going to the doctor's office and going even to the emergency room is a long distance. And in this case, it is possible for us to contact you. And in that case, this will be virtual care. Another case is not directly talking with the patient. And then actually, it is between healthcare providers, we are helping each other. For example, we're in the north, there are a lot of good nurses and good doctors, and they are helping their patients. However, sometimes there may be 4 or 5 patients who are coming in, and then we in a VGH, we have more doctors and nurses and friends who can offer help. And if there are smaller towns, sometimes we can use virtual care, helping them here and now to help our colleagues. And the hybrid care will be combining in-person and virtual care visits. Now, so imagine if you go to the bank. So sometimes you may say, oh, okay, I would use the ATM to get cash, or I can pay my bills through the computer. And sometimes I can take a picture so that I can have my check deposited into my bank account. However, for some more complicated things, for example, if I want to get a loan, then I have to go into the bank to see my account manager. So it is the same with healthcare. So it is easier to see the doctor, but in many situations, so well, we have to go in person. So the next one. So actually virtual care, we can make use of different communication technologies. For example, video conferencing like now, telephone, text messaging, or even email. For example, I have some rash I would like to see, and then just talking, well, I would like to see the situation, so you can place your hand as close to the camera as possible. And you can also take a picture, and then the doctor can see much clearly. And this can all help us through virtual care. Now, of course, there are benefits, saving time. For example, if it can be done through virtual care, then we do not have to go to the doctor's clinic. We don't have to drive. We don't have to park. And then that will be a great help. And if you're in the interior and you have to fly to Vancouver, spend a night in the hospital and see the doctor the next day for just 10 minutes, and then you have to go back to the hotel and take the flights back home, of course, it will be a much longer duration of time. So if it is suitable, virtual care can help. However, and then if the health situation is not serious, then can decrease the use of emergency room. And then if you use 811, this service is actually to differentiate whether your symptoms require you to pay a visit to the ER. And also you can reduce the spreading of diseases. So today, we are doing it online. So we are not spreading viruses or diseases to other people. And this is our wish, that everybody remains healthy. And some people say, oh, if I go to the clinic or if I go to the ER waiting area, that will increase the risk of passing and catching diseases. But I would like to stress, if you do require emergency care services, things like heart problem, stroke symptoms, then don't worry about the risk of catching diseases. Our hospitals are very well equipped, so are the clinics of our doctors, so that we will protect you from contracting viruses or germs. So if it is necessary, go for it. So the next slide. So what are the limitations of virtual care? Now, if you do not have a regular healthcare provider, and then you just go to have care through virtual care, then your GP may not really understand your situation, and there will not be a continuity of your care. And so you may say, well, this is easy. I would just go to A, and then I could go to B clinic. But your history may not be pulled together and being governed by a partner who is your family doctor and helping you to monitor your health. The second thing is virtual care cannot help you to deal with emergencies. When a person is facing emergency, then don't delay. Do not use virtual care. Go to the hospital or the clinic. And the third one is for clinical appropriateness. So for me, through virtual care, really, well, cannot help. For example, if you abdominal pain, well, I can talk about it, but I cannot really examine you. I cannot reach out through the screen and push you. So for the family members beside you, I might be able to help, but I cannot listen to your heart. I cannot listen to your lung. And for the time being, virtual care cannot do all this. And in these situations, so let us look at the next one. Oh, okay. Yeah, the previous one. So talking about emergency care, if you suddenly have a chest pain and the chest pain lasts for 15 or even 20 minutes, don't wait. So for this situation, or let me see whether I can get virtual care through my doctor or whether I can go online. So in situations like these, even calling 811 is too slow. Call 911, especially when you have symptoms of heart diseases, especially when it is the first onset, go to the emergency room. Don't use virtual care. And finally, I have got some tips. And before you use the virtual care, what preparations can you have? And so that virtual care can be more helpful to you. The first thing is, before receiving virtual care, you have to call the doctor's office. Now, if you have a family doctor and you are not sure whether your family doctor provides virtual care, then call to find out whether they have virtual care. If they say yes, okay, then you can properly prepare yourself. And to prepare yourself, you have to think, what device? Am I only using the phone, or do I use my smartphone, tablet, or my computer? And the third thing is very important. If you are doing virtual care, you have to choose a private and a place which is well lit. Look at this. If I turn off my light, then it is bad. I cannot see you. But if you're in a place which is well lit, then I can have a much better observation. And another thing is, if you have family with you, so we welcome, many doctors welcome them. Oh, I have my daughter or my son next to me. Of course, I would welcome that. So in that case, you have to let me know. And then my son is with me. So this is something which is really beautiful. And make sure you go to a place which is quiet. Now, sometimes they give me a call through 811, but they are in the middle of a coffee shop. So in that case, then I said, sorry, I cannot talk to you. So if you're using virtual care and then you're connected with the doctor and you're in a place which is not private enough, then you have to let the doctor know. And we would like to ask you, well, are you in a place which is quiet and private enough? So do you think it is safe and appropriate to talk to me? So this is something to communicate. And also, if possible, before the actual virtual visit, then do a test call. Now, when you see the doctor, so when it is the first one, of course, you need your insurance card and then what records you have. So, well, I have paper and notes, and then my children will say, oh, you are not advanced. I usually would key in everything in my smartphone, so you can get that ready too. And if you have history, say the blood medication, what symptoms you have, especially so if it is the first time you see that nurse or doctor with that information, it would be very helpful. The last one, there are a few things I think people should be aware of. So if you go to the hospital, there will be the nurse who will to measure your blood pressure or your temperature. But at home, we cannot do this for you. So I suggest, so you have to prepare yourself a few things. The first thing is how to test your body temperature. Of course, you can do it over your forehead or under your tongue, or that is a infrared thermometer. If you can tell me your temperature, that will be a great help. The next one is about blood pressure. So I suggest everyone has a blood pressure monitor at home because blood pressure would be important for healthcare professionals to help you. Now, this is actually hypertension.ca. This is a non-profit website, but this is very important. Of course, it is about hypertension, providing a lot of good information, but one of it is if you are planning to buy a blood pressure monitor, then it would tell you which one is helpful. So there will be the golden check. So this is what they recommend. And you can see how to buy these kinds of recommended monitors. And the third one, we would like to know your heart rate. Now, many people, they are wearing different watches and how fast your heart is beating. And there are free apps which can be downloaded. Now, remember, they are free. So they can be downloaded into your smartphone and then place your finger at the area where it is lit, and then it will count the heartbeat for you. I cannot tell you how to look for it, but I hope there will be workshops which can further help you. And the last one is about the oxygen saturation. Now, usually this one, usually you can buy these ones from the drugstores. In that case, we can tell how saturated the oxygen is in your blood. If I know your heart rate, if I know your blood pressure, if I know your temperature, they are very good. However, if you can tell me the oxygen saturation, it will even further help me. So if you could do so, please do so. Now, some watches claim they can test the blood oxygen, but usually up to now, so only through the fingertip and through the earlobe would be more accurate. So wearing a watch on the wrist, the accuracy is not as proficient yet, and I'm not reprimanding that. So the last one, to me, this is really important. This is Health Gateway, which is provided by the government, which is non-profit making. And I think you actually should have known this because in the past 2 years, so if you would like to register yourself for the for inoculation, for COVID shots. And if you had to go into the restaurant to show that you already had a barcode, then actually you had gone through the health gateway. So if you have done that, you have already signed in into health gateway. And if you have not, then there is the link. Go to the website and then you can start working on it. Why is it important? Because this app has already downloaded many of our own health information. So it's not only our COVID shots, but all our inoculations, for example, even under the medical board, and all these shots that have been done are recorded. And also you can find record of your medication. And the third one, it keeps record of all the clinics of doctors you've been to. There are reports there. And the fourth one, it will be all the lab work. Now, before, when I wanted to check my lab result, then you can go to the, through the lab, and then you can sign in so that you know. But now you can know all the blood work result within 48 hours on the health gateway. So you don't just look at the lab result, but you can have the history of what other examinations you have gone through before. And also for Health Gateway, you have to key in something, for example, annual blood value. And then the doctor may will say, well, okay, I can note it. This time my blood sugar is a little bit high. So you are building up your personal data, and all this information is protected. Your privacy is guaranteed. And down the road, we can find more and more information in the Health Gateway, and we will talk about more of this in our workshops. The next one, we are talking about almost the end of my presentation. So in the very beginning, there was a video about the HealthLink BC. So if you have any questions, there is a lot of information online. And also you can dial the phone number 811, and then for you can say your language of choice, English, Cantonese or Mandarin or whatever, and then they will have interpreters who can reach you for different information. There will be different doctors working with the nurses, providing virtual care. I hope that all this information, which can guide you to further information, and I really hope that there will be workshops who can further look at digital health. And then here are some further links providing community resources, and I hope these will help. So passing on the time to you, Barbara. So thank you, Barbara. So now with the advancement of knowledge, there are so many different equipments or apps. I agree that everyone, people in BC should try to use Health Gateway to look into your own health record, for the time being part of your health record. And for many people, they say, oh, I do not have a family doctor, or my family doctor has retired. But if you have all this information, then you can do better self-management. So now I would like to invite the guest speakers that we have today so that they can answer the questions that we receive. Some questions, when they registered, they already have put in the questions. And for other questions, has been covered, and we are not going to repeat that. And for other questions, they are more personal. So, well, it would be difficult because we do not know your personal medical history, and it would be difficult to address those. And we are going to choose some of the questions to respond to.
Okay, everyone is here. So everyone is here. Charmaine, Laura. Gloria, are you there? Gloria is not here. Maybe she just stepped out. Yeah, that's fine. But actually, there are lots of questions to ask the nutritionist about. I'm here, Diabetic. Okay, thank you. Okay, there's one question. I think this should be answered by Dr. Ma. There's fatty pancreas. Does that mean it's prone to have diabetes? How do you get rid of fatty pancreas? So, Dr. Ma, I don't know the questioner. Are you talking about fatty liver? Because fatty liver is more common and is when you have chronic excessive fat, then there's fatty liver. So although the pancreas is next to the liver, but of our organs, internal organs, actually it can affect our overall health. I believe it has to do with liver, not the pancreas. So you can talk to your family doctor, or and if your pancreas, for example, had infection before or had been injured before, maybe your pancreas has been damaged. So it's I think it's best to talk to your family doctor. Thank you, Dr. Ma. The next question is for Laura. This person says that his or her personal blood test gauge, would it be different from the ones that the doctors use or the ones used in the hospital and may not be so accurate? Usually the ones used in the hospitals, they don't do it every day. Like when I was working at the diabetes center at VGH, we used the old machines to, it was a big machine to test blood sugar. So every day we had to do quality control. We did it daily, so to make sure that it was accurate. However, if you poke your finger, this gauge that you poke your finger with, but my suggestion is every year, the doctor will write you a note to go to the lab for a test. And if the doctor writes the note, you can ask the doctor to have a fasting blood sugar checked. And then you take your gauge with you, your finger poking gauge. After they have done some blood work, within 5 minutes, you poke your finger again to test your blood sugar. And then you can look at the report afterwards to see how the comparison between the 5 minutes after the poking and the fasting, whether it's within 15%. If it's within 15%, then it's accurate. Thank you. The next question is for Gloria. So some of the questions Gloria has actually covered in her topic, because this person is asking carbohydrates. How does it affect the health of a diabetic person? So does it mean someone who has diabetes, they should not take carbohydrates and should take more calories and higher fat contents foods that have those? And the other thing is, how do you solve the constipation problems of someone who has diabetes? Actually, you have a few questions there. First, should you eat high calories foods or high fat foods if you have diabetes? I think that in my presentation, I've mentioned that, and everyone, their demands are different. So other than that, for every meal, how much starch should I take? So everyone's different. It depends on your personal, your age, your life habits, your exercise level, whether you walk to work, or whether you drive, at what time you take your medications, or whether you take insulin injections. So there's a list of factors that can affect each meal, and the calories and the fat and the carbohydrates that are needed for each meal. So there's no one answer that fits all. So because I can't answer this question to one patient, and everybody thinks that it applies to them as well. So you have to know your personal carbohydrates and fat needs and all that, and you ask your doctor and they can tell you. Right, it's a personal health thing. It's so thank you. Okay, I don't know who should answer or who wants to answer this question. The question is, how can you maintain your weight, keep weight, but not lose weight while type 2 diabetes? So this person has type 2 diabetes. So how do you keep your weight and not lose it? Who wants to take a stab at it? Okay, maybe Dr. Ma, you want to give it a try? What's your take on this? Of course, okay, when we talk about weight, but I think everybody wants to answer this question because everyone has, has our preference. As a family doctor, let's talk about the overall view. Whenever we talk about weight, we talk about eating, exercises, and Gloria reminded us. So how much do you eat every day? And other than eat, what are your choices? What kind of nutritious food do you take? So if you take proteins, so at the same time you need to do exercises. So this is different with every stage in our life, because children, adolescents, and adults or seniors, they're different. It all depends how much exercise you do every day. So what is needed is healthy foods, a balanced diet, proteins, and other nutrients. And so doctors worry about tea and toast. The doctors worry about tea and toast. Don't just stick to those, and then you neglect about meats. And as you grow older, you think your digestive abilities are not so good, and so you can ask nutritionists about what to take, and you can also talk to a family doctor. But you should also maintain your weight, and you should talk to your family doctor to keep at what level should your weight be, what is overweight, what is underweight. So what does it mean that everything will be saturated on your belly, or is it because of the pandemic that you don't go out that much, that your muscles, there's atrophy in your muscles? Maybe our physiotherapists can deal with that, or our actually occupational therapists can do these things to make an assessment or make a plan for your exercise. So what kind of exercise they can prescribe you every day for you to maintain your weight, as well as keep your muscle and so that's, so I think everyone wants to say something about it, chime in, but as far as food, you have to choose healthy foods, but don't forget to exercise. Thank you, Dr. Ma. The next question is for Laura. This is about foot care. This person has type 2 diabetes and the feet are very dry. And this person has tried to use cream, liniments, and lotion, but still it doesn't work. What other tricks, what other suggestions do you have? Can this person do? Actually, if you have diabetes, basically your skin is dry. That's one of the common issues for those who have diabetes. Of course, we don't want it to be so dry that that it will crack. That if it's cracked, then it's a wound. So just out there, you can buy lotions and creams. If they don't work, then you can ask your pharmacist. And then over the counter, you can also buy some special formula liniment for the feet or for the hands. For example, the elbows. It's written there. So usually it's some urea-based, more higher percentage lotions, creams. So you can try those first. If those don't work, then maybe you should talk to the doctor, or the doctor will have to prescribe some prescribed formulas for you. Okay, thank you. There are a few of us who asked the same question. Maybe we should ask Dr. Ma. So you talk about testing your blood sugar. So diabetes has the insulin supply has associated. Is there a way to check your insulin in BC? Actually, I think a lot of people have thought deeply into that. So I'm thankful that you're listening carefully. It's not just sugar that we are concerned about. We're also concerned about insulin. So you can think about, why don't we also test our insulin? Actually, there are many reasons for that. And if I want to go into it, it will take a long time. So I'm going to share some of the reasons for your insulin. Like I said before, after we have eaten, it produces sugar that goes into the cells, and it's not like at the same time on a given day that it gives you a certain number. Other than that, when you slowly goes into type 2 diabetes, this process is not overnight. It takes many years, and so we realized that if you are worried about having diabetes, then your body, when you decrease your insulin, when the insulin is decreased, actually the body produces more insulin, because our cells, our muscles have reduced sensitivity. So our normal insulin test, where some of you will see a higher index, a figure, but it doesn't mean that over 1 year, 3 years, 5 years, or 10 years before it, you have type 2 diabetes. So it's different from type 1 diabetes. Type 1 diabetes is when your pancreas stop working. I don't want to create insulin, so that's a 0. So we know that you have type 1 diabetes. But when you have type 2 diabetes, if we want to test an index, to get an index, a number, we will know that in different countries, they have tested insulin. And the normal range is higher because it's a hormone. Some are within the normal range, some are a bit high, tend to be high. Maybe when the near future, there's a chance that they will have type 2 diabetes. So if that's the case, we have a more direct and faster approach, and also a cheaper approach than you test your blood sugar. So that's why for the time being, we test our blood sugar. The last reason is that we have done research, and we realized that, I don't know why, but in the same person, if you have the same blood tube, you go send it to different labs. So we know that blood sugar tests are more common. We usually do that. So when you test insulin, the stability is not so high. So some think that maybe because within our blood itself, in the process of transfer, the insulin, the index will change. Another thing is, some people may have immunological issues, and so there's resistance. There's some antibody in the insulin which we cannot detect. So at the end, in the lab, there may be other things that when it comes out, and it's insulin-like. So for the time being, as far as medical science is concerned, insulin test is not so accurate. So we don't suggest, we don't routinely tell you, oh, well, you're worried about this, let's do that together. So if you're interested in doing this kind of test, I believe that maybe if you pay for yourself, you can test for yourself. But after you've tested, does it mean that if you are higher than the normal range a little bit, is it because you have a full stomach, or maybe for 2 years, 3 years, 5 years, 10 years, you may have diabetes? We don't have sufficient data to tell you. So even if you have tested it, maybe it's not that useful.
Oh, thank you. So because of time, we are going to answer 2 more questions. There are actually a lot of questions relating food. So maybe one more question for Gloria. So everyone would know. When we take in carbohydrates, how much should we take? So we have actually talked about how much carbohydrates we need. I will give an example, so you would know roughly how much. For an ordinary average person, a male of a mid-size, healthy eating, who does not reduce the intake of carbohydrates, so it will be he will only require 200 to 300 grams of carbohydrates. So when you hear 200 and 300, you will say, how would I know when to take 200, when to take 300? So then, well, I said mid-size, and therefore there will be a lot of variance, whether you are a smaller size, whether you are a lady, or whether you're an elderly. So that's why many people ask this question, and this is of such a general thing, which cannot be suitable for everyone. So I would say 3 to 4 servings. So earlier on, we talked about carbohydrates servings. So therefore, it will be 3 to 4 servings. So when I say 3 to 4 servings, it is not for everyone. Now, for example, I'm planning to do exercise in the afternoon, then 3 to 4 servings would not be enough. And then for nighttime, 3 to 4 servings will be a bit too much, because after dinner, you may be just washing your dishes, and afterwards you may go to bed. And then you may not be able to take so much carbohydrates. And some people may ask you to add a meal before between lunch and dinner, and therefore you don't need as much carbohydrates during the dinner time. And so for everybody is different, and there will be different medication needs, and therefore you have to see a dietitian to evaluate that. And one more for Dr. Ho is about Health Gateway. So actually there are a lot of questions about Health Gateway, but this friend would like to know, when you have MSP, then you can go to check your health records. Health Gateway, there are a few things which can protect your privacy. So not only requiring you have MSP, if you can approve your identity, whether you have passport, or whether asking you to have your cell phone, and then you have a BC service card, and there is another app to verify your identity. You can authorize another person to check your Health Gateway, but not a person does not mean only having your MSP number can check all the information. And also what kind of history is inside. Now, for medical history, so the records goes back as far as 1995. And if which doctor or clinics have I attended? So we have records of the past 7 years. And therefore, the information is not from the time of your birth. And we are building that up gradually. So from today, this is the information I give. And maybe after 2 to 3 months, there will be increasing information. So the best thing is for you to get to know, use Health Gateway. And we are planning to have further workshop for people to know about Health Gateway. Thank you. Thank you for staying behind to answer the questions. So actually, we still have a lot of questions, and then we would like to collect all the questions. There will be a special workshop to only answer questions. So I hope everybody stay tuned, and we are going to make arrangements later on. And today, I'm very helpful. We are very thankful to the Ministry of Health for their support through Patients Partners initiative. And we hope that everyone would keep going on to the website and then scanning our QR code to provide feedback through our survey so that we know how to proceed with our future arrangements or future forums. We would like to thank our community partners. There are a lot. And we would like to, well, they are in no specific order: CCMS, BC, CRC Health Cantor, Mosaic, Fraser Health, Richmond Cares, Richmond Gives, Caregiver Hub, and South Vancouver Neighborhood House Caregiver Support Group, the BC Type 2 Diabetes Network, University of Victoria, Vancouver Coastal Health, Family Practice, Vancouver Division, Vancouver Public Library, and Villa Cathay Care Home. And for media partners, we have Fairchild TV and Omni TV, Mingpao Daily News, and Singtao Daily to help us. And then I really appreciate the viewing hubs. So those 4 places will be CRC Health Center and Success Jackson Lam Adult Day Center, and South Vancouver Neighborhood House, as well as Villa Cathay Care Home, to arrange for the receive walk-in audience. And then I do appreciate the speakers today, Dr. Ma, Laura Ng, Gloria, and Dr. Kendall Ho, to provide such detailed presentations. And today, everything that we have said, we will be recorded. And after 1 to 2 weeks, and after we have properly audited, we will put it on site on iCON website. And we are very grateful for the interpreters who've been working very hard, who are providing simultaneous interpretation. So there are 4 of them: Shiny, Wenhui, Benny, and Josephine. So, and if you still have anything to check or to participate, please go on to our iCON website, www.icon.org. And then you can follow up with our future activities and to review the recording of today.